Welcome to Aging Untold. Osteoporosis weakens bones silently, and for adults over 50, the threat of a major fracture rises steadily with age. Research shows low bone density is strongly linked to hip fracture risk, especially after age 80. Dr. Ray, we hear about osteoporosis all the time. What is it, and how should older adults think about screening and prevention?
Well, osteoporosis is where the bones become very porous and it makes them very weak and fragile. And as we get older, we have thinning of the bones and that. And we call it the silent disease because you start to have bone loss way before you have symptoms. And so the bones are getting thinner, they're getting weaker, you're more fragile. And then you'll see people just with a simple fall will have a fracture. Or even just bending over, you can see things. And
or a spiral fracture that causes the fall.
Exactly.
Yeah.
So you'll see that all the time. And so as we get older, you have to remember we're losing muscle, that's sarcopenia. When you lose muscle, you lose strength, you lose balance. And so it makes it so much easier, it makes you more prone to that. And you know, there's a spectrum. So the spectrum is when people get a bone density scan done to evaluate for bones, most of the time they say about age 65. However, anybody who has not making hormones, menopausal, that's the biggest risk factor. Although insurance a lot of times won't cover it because you may have had a hysterectomy, don't have your ovaries, you're menopausal, you're at an increased risk for osteoporosis. So many people, if they have that risk there, they'll look at the bone density. There's a spectrum osteopenia based off of the numbers prior to osteoporosis. But it's really, really important specifically to prevent it because the effects after a fall or a fracture are so devastating.
Yeah.
Yeah.
So losing hormones then can start this cascade effect where you start losing bone, losing muscle, you start losing bone. And so
Yep, that's not the only risk factors.
Oh,
you
absolutely not.
you also have family history, low body weight, smoking, heavy alcohol use, low activities, calcium, you know, certain meds, long-term steroid use can lead to this. So we think about it as a women's only, but it's not always. I mean,
and
yes,
thyroid, low thyroid.
Thyroid.
Huge.
So, you know, we as women, we're more prone, but men do develop this as well.
And I think if you understand kind of what's happening in this process, you have this imbalance. You have these osteoblasts, these cells that build muscle. Think of it like build osteoblasts, and then you have osteoclasts, which are breaking down muscle. So as we get older, we have more osteoclasts than we have osteoblasts. So things like inflammation and things like that will spear osteoclasts, so they're breaking down, and you're not building. So you need hormones to help stabilize. You need growth factors, which those osteoblasts has those receptors to help build the bone, and you need the nutrients. You need vitamin D, but you need vitamin D along with K2 so that that calcium stays in the bones. And magnesium is huge. 50% of the bones have magnesium. So when you lose magnesium, you have fragile bone.
So here's the untold truth. Let's just be frank. The untold truth is that a lot of the prevention is not covered by your insurance. A lot of the better prevention may not be covered by your insurance. People don't want to hear that. But exercise, strength building is free. But really being your own coach, your own advocate to help keep your muscle, keep your bone, really important. And I often say that one fall can change it all. If your goal is to stay independent, and maybe stay in your current home, you want to do everything you can to prevent the fall because that can instantly change everything for you.
And I think, Amy, you were saying something, we were talking, and you were telling me about some of the genetics and things that you had read. I thought that was very interesting.
Well, I was thinking about how to prevent it, you know, and genetic testing, and is there value in that, and should you talk to your healthcare provider? So it's like a big thing. But when I was thinking about genetic testing, I thought, should I do that? Is it valuable? I thought, well, it probably is. I'll defer to you. What do you think?
Well, there's some genes that they're testing for that make people more increased risk for osteoporosis. Like there's a gene that's in the vitamin D receptor. And so when you have these miscues and all that, that makes you more prone. But the other thing, because we're seeing on the rise, is autoimmunity. And so there is a part of an entity of osteoporosis that's autoimmune osteoporosis. And I think that's why we're seeing that, because if you have that's genetic. So,
And we know there's a family history. We know that it can be a family history thing. So if you've developed osteoporosis, then the main thing would be trying to prevent the falls.
absolutely.
Ask for that bone density screening and ask for the screening to find out if this is a problem.
Right, and then know that maybe some of the traditional treatment that you would be better served to do more than that. Amy?
The National Osteoporosis Foundation. Go there. It's a wealth of information, both support groups, clinical trials, et cetera. So if we're throwing you a lot of information here, go there for some
There's
follow-up.
a lot of other good resources as well, like the bone coach and just different things. So there's a lot of good resources. Keep asking questions. That's important.
Yeah.
And we'll be back with more on Aging Untold.